Welcome to the Genius Factory. Enjoy the video.
You start by confirming the kit has essentials and then taking immediate action. Sanitize hands and clear a workspace so everything is visible. Once done, inspect the person for life-threatening issues and stop heavy bleeding first using direct pressure and clean dressings. Make sure to check the thermometer and note temperature. You do this because stabilizing bleeding and assessing vitals tells you if basic care is enough or if higher-level help is needed. This saves time and prevents escalation. Now you move into treatment. Gently clean wounds using saline or antiseptic wipes, removing debris only when you can see it clearly with tweezers. Then apply the correct dressing and secure it. If there's suspected fracture, immobilize using a splint or firm padding to reduce pain and damage. You should also monitor breathing and circulation while documenting any OTC meds you give, including time and dose, because accurate records guide later care, and avoid accidental overdosing or drug interactions. To finish, you secure dressings and label them with time and any meds given, then brief the patient on warning signs and when to seek follow-up. Once stable, restock the kit immediately and note expired or depleted items so the kit is ready next time. If something goes wrong, persistent bleeding despite pressure, increasing pain or swelling, trouble breathing, or a fever over 38 degrees C, seek emergency care without delay, because those signs indicate complications beyond basic portable kit management.
Thanks for watching. If you found this helpful, don't forget to like and subscribe.